time in hospital. The end result is high cost, low quality, and suffering that could have been prevented with relatively simple, inexpensive primary care. One of the heroines in the New Orleans post-Katrina was a young member of our faculty, Dr. Karen DeSalvo. Immediately after the storm, she started a clinic literally on the streets of New Orleans. This clinic then moved into a tent and from there to temporary accommodation. She has led a revolution. Last year, 175,000 people, yes, 175,000 people received their care from community-based clinics across the city. High-quality, lower-cost health centers with easy access right in the neighborhoods. 3 years ago, this number was 0. Tulane, following Katrina, has taken on the role of reforming the school system in our city. Louisiana's public schools probably have the highest number of high school dropouts in the country. Today, through the efforts of the Cowan Institute, named for the president of the university, amazing improvements have been seen in the public schools across the city. The revolutions in education and healthcare could probably not have been possible had it not been for Hurricane Katrina. This natural disaster was an absolute tragedy, but through the determination and courage of many, this adversity has been turned into an opportunity. University graduates in North America are being drawn to public service in large numbers. Across the USA, we are seeing young people after college joining AmeriCorps or Teach for America programs. Young people are coming to New Orleans from around the country to make a difference. Tulane now requires every single student to perform public service in order to graduate. The amazing result is that this year, our undergraduate school received over 43,000 applications compared to just 16,000 pre-Katrina. And our medical school received over 10,000 applications, which represents 1 in 4 of all applications to medical school in the United States. I love to travel and have enjoyed getting to know Colombia. What a beautiful country you have. Today, Colombia is emerging from a violent period fueled by narcotics and insurgencies. We in North America need to take responsibility for the money that has fueled the narco war. Despite this painful period, your country spends a high percentage of its gross domestic product on education, and almost 93% of the population 15 and older are literate. Just in the last 5 years, enrollment in higher education has increased from 27 to 34%. Your country has a rich cultural heritage and has produced many international renowned artists. To name but a few, the Nobel Prize winner Gabriel Garcia Marquez, the artist Fernando Botero, writers Vallejo, Restrepo, Mutis, and musicians such as Shakira, Carlos Vives, and Juanes. Today, you are graduating from the most prestigious university in Colombia, one that prides itself on its research and education. Over the last 13 years, the Universidad de los Andes has seen amazing growth under the leadership of Rector Carlos Angulo. Today, you will join the ranks of the alumni who are amongst the most influential leaders in Colombia in economics, politics, social reform. Each one of you can make a difference. I have a question for you. Is there a doctor in the house? ¿Hay un doctor en este lugar? Please. Louder. Is there a doctor in the house? Yes? Oh, great. Now I can hear a little bit. You are the first graduating class of the Universidad de los Andes Medical School, a medical school built by an extraordinary team led by Dean Mario Bernal, along with the visionary director of Hospital Universitario Fundación Santa Fe, Dr. Roberto Esguerra. It is a privilege to be a doctor. Every day you will help people who will share with you their most private thoughts. Some you will cure, some you will relieve their suffering, but others you will only comfort. I am confident that you will make a difference in many people's lives.